Well, welcome to the 9:30 call here, where we're going to highlight priority number 7 from the early childhood agenda. I'm going to turn things over to Greg, Hagan, and Charlie Homer.
So good morning, all. Very briefly, Greg Hagan, general pediatrician from Cambridge Health Alliance and longtime resident of the city of Somerville, longtime advocate for children, and co-founder of the Child and Adolescent Health Initiative that we are here to tell you about today. Charlie.
Great. Hi, everyone. Thank you, Amy, and everyone. Pleasure to be with you today. My name's Charlie Homer. Like Greg, I'm also a general pediatrician. I've practiced here in the Boston area at Revere and the Children's for a good period of time. I then founded the National Institute for Children's Health Quality, NICHQ.org, and led it for the 15 years. I served briefly in the Obama administration addressing issues of health and humans, particularly human services, and then came back and worked with Greg and Jim Perrin to found the Child and Adolescent Health Initiative. That's who I am. Why don't I spend a minute talking about the Child and Adolescent Health Initiative and then briefly give context for that, and then Greg will go on to tell us more about the Children's Cabinet Bill and the exciting legislative process that we have embarked upon as part of this broad Strategies for Children agenda. So the Child and Adolescent Health Initiative started, at this point, it's been probably 5 or 6 years ago, I think, is probably the timing. It was really triggered initially. Massachusetts, I think many people on the phone, on the call know, Massachusetts approximately 5 or 6 years ago redesigned its Medicaid program, which is called its Mass Health program, under what's called a waiver. That is, they asked for a change from a standard Medicaid program to develop a new and innovative approach. And that innovative approach that Massachusetts developed had a lot of really exciting elements that were important. In particular, it really promoted the integration of behavioral health into primary care, and it also enabled addressing social needs to a greater extent through the healthcare system, much more than previously. So all of that was wonderful on the one hand. On the other hand, the folks who designed that particular approach to Medicaid reform sort of forgot that the largest proportion of people in Medicaid are children. And so none of these exciting, radical new designs really had any benefit for children. So initially, a group of pediatricians came together and said, we really need to change this so that children are better served. So initially, it was really a group of pediatricians. We initially met with the Medicaid leadership at that point, the Mass Health leadership, and they said, basically patted us on the head and say, yeah, that sounds nice, but why don't you talk to your healthcare leaders and in your accountable care organizations, they can solve the problems for you. And eventually we convinced them that that wasn't the case, in part because the Medicaid director himself, Dan Tsai, who now runs Medicaid for the country, himself had a child in the process, and sort of we counseled him about sleep and eating, and he realized that children are not little adults and they maybe need a new health system. So initially, this was a group of pediatricians that started working on thinking about how to redesign the Medicaid waiver. But we rapidly realized that the issues that we wanted to address were much broader than just those in the medical profession should address. And so we broadened our coalition and created the Child and Adolescent Health Initiative, which really includes parents. It includes educators, it includes a broad group of child advocates, and we have been working as a broad coalition for many years, and in fact had substantial input into redesigning the Mass Health Waiver, which has since been submitted, has since been approved, and is in the process of implementation. And many of the elements of that waiver do in fact do a much better job addressing the needs of children. And in the course of that, we identified that some of the issues that we wanted to address were in fact substantially broader than Mass Health alone. And that led us to issues created to the Children's Cabinet. So I'll hand it over to Greg.
Thank you, Charlie. In some respects, pardon me while I silence my phone, I apologize. Probably won't be a surprise to anyone on this call because I'm looking at the range of interests and backgrounds for folks on this call. It's having healthy children and families is not all about what we do in healthcare. So why do we need a children's cabinet? We live in a fairly progressive state, fairly well resourced. We care deeply about our children. And so we have a lot of supports and services for children and families. But for a variety of historical reasons, those services and programs are spread across a range of different agencies and programs at the state. Department of Education, early education and care, child welfare, mass health, behavioral health, housing, and for kids with disabilities, a whole range of other agencies. So we, in some sense, we mean to do well by children and families, but there's consistently very poor coordination and communication among these various agencies and programs. Probably not a surprise to anyone on this call. And when the state agencies don't coordinate and communicate well, that leads to inconsistent focus on the needs of kids and families. It leads to really inefficient resource allocation. And as I like to say, I'm a taxpayer as well as a child advocate. I want the resources that the Commonwealth is providing for children and families to be effectively used. And then finally, this lack of communication coordination leads to a system that is insanely difficult to navigate for families. It is a bewildering array of services, and it's just very challenging for children to access things that they're actually entitled to. Again, nothing probably news to anybody on this call. In addition to that, though, there is a really marked difficulty in coming up with any useful data by which we can evaluate the effectiveness of the programs. And if you can't measure data, how do you assess the quality? How do you assess our success in getting where we want to be as a Commonwealth for kids? And really, in some sense, at the bottom of all of this is the problem that there's no clear vision guiding the state's efforts to support families and youth. So creating a children's cabinet under the bills that have been filed in both the House and the Senate that would create an entity within the executive branch, and it would require the secretaries and commissioners for each of those major offices and programs that serve children and youth to meet at least quarterly to develop some cross-agency strategic planning, to come up with measurable outcomes so that we can actually measure progress towards the goals that we all share. It would create child and youth impact stations to evaluate proposed legislation and appropriations. And I think really critically, it's going to generate an annual report to the legislature on the status of children, and allow us to track that progress. I'll also note that it is very difficult for us to think about addressing traditional racial, social, economic disparities and assuring equal access to services if we don't do this. So the last element in this bill that I think is utterly critical is that it also requires that there be an external advisory panel, and this would consist of members of the various stakeholder groups that work to support children and families, the early childhood sector, teachers, school administrators, child welfare professionals, therapists, pediatricians, all of these, and importantly, parents, families, and children, youth themselves. These folks will be able to advise the cabinet, keep them grounded, because these folks have the lived experience and the sort of rich expertise that can inform our efforts to come up with a real integrated, coordinated plan to support children and families in the future here in the Commonwealth. That's what I got.
Thanks, Greg. And so I put in the chat, I attached the one pager that folks have developed, as well as the full name of the bill. And do you just want to talk a little bit about the legislative briefing that we did on Monday afternoon? I can put kind of I'll put the speakers in the chat, but just kind of your sense. And I think also, and we've talked about this, as a pediatrician and not a registered lobbyist necessarily, can you talk a little bit about your perspective as kind of working on legislation, working with elected officials? It'd be great to hear your perspective.
Yes, it'll probably come through loud and clear that I am, definitely not a registered lobbyist. I do my best, but this is not my area of expertise. But that said, with the really wonderful support and advice of much more seasoned hands, Amy being one of them, and other folks, we were able to stage a legislative briefing on Monday to try to drum up interest and support for these bills. But stepping back a little bit, we first approached Representative Kay Khan, who some of you, I'm sure, know. Last session, she was really responsive, very excited about this, and put forward a bill which then went to the Committee on Government Operations Affairs, or I'm not sure the exact title, but the chair of that committee was really excited about this. There was an initial hearing 2.5 years ago, and I went into that virtually, not really knowing what to expect. And the level of excitement on the part of Representative Cabral from New Bedford was heartening. And that initial effort managed to get the bill to House Ways and Means, and of course the session ended and we're back to square one. This time around, Representative Khan and Representative Cabral have once again enthusiastically sponsored this bill. On the Senate side, Senator Sal DiDomenico has also very enthusiastically embraced this concept in this bill. So on Monday, Representative Khan, Representative Cabral, and Senator DiDomenico had the opportunity to speak briefly about their experience with these issues in the past and the need for a children's cabinet. What I thought was perhaps more affecting for me personally was we had Melanie McLaughlin from Family Voices and a parent, Jamil and Johnson, and they could speak about their own lived experience with raising children in a bewildering and confusing system. I thought the response was pretty good. Those of you who go to legislative briefings on a regular basis could probably speak to that, but it seemed to go off fairly well. Folks were certainly very enthusiastic. I will ask folks on this call very briefly, if this is an idea that resonates with you, please put in a kind word with your legislators, because I think that looking at folks on this call, a lot of different really important sectors, people doing important work in different areas for children and families, getting this larger vision right on the state level, I think could be enormously helpful for all of us in all of our respective areas working with kids and families.
Thanks, Greg. And there was a question in the chat about what was the result or learnings from Governor Patrick's formation of a children's cabinet in 2008. And the other speaker, besides Greg and the legislators, the parent, Melanie, and me, was Paul Rebel.
Right.
And so I'll turn it to Greg to kind of that strategic move.
Forgot about former Secretary Rebel. So again, folks on the call are probably familiar with Secretary Rebel, and he has not only his own personal experience working this issue in the Commonwealth when he was serving as the secretary, but when he left state government and went back to his academic world, he has been working really closely with mostly local cities and towns across the country to come up with local children's cabinets. And he gave a very, I thought, a really informative talk about why this is so critically important. And one of the things that struck me in the course of listening to Secretary Rebel talk about how educators think about success in schools over the last 10 to 15 years, I was really struck with how it's exactly analogous to the way folks in healthcare have started to think about health. He likes to say that children spend 80% of their time in places that aren't school. So school really can't solve all their problems. In healthcare, I think we've all come to realize that what we do in the clinic or the office is a teeny tiny portion of maintaining health. So the focus from both the ed side and the healthcare side has shifted to social conditions. And that is really, I think, a really critical inflection point that will inform the way we think about this vision. But we got to get the bill passed first.
And I see
Maybe-
Kate had her hand up. Oh, so go ahead, Charlie.
Yeah, I was just going to answer a little bit that question that came into the chat about the 2008 cabinet, because Paul Revel did talk about that. I mean, he said on the one hand, it was useful to have the ability of the cabinet chiefs all talking together about the issue, and there were some limitations, which were there was no accountability built in. And again, this bill addresses that in part with the idea that there has to be an annual report, and there are these various impact statements, and there's the advisory board. So there are a variety of strategies that create accountability. And the other, and this is something we're going to have to address in the course of the legislation, is there was really no staffing for the, there was no office that was really responsible for doing the work. So that'll also need to be something that, as this legislation moves forward, we're going to have to work on, whether there's a budget ask or whether that's put in as an outside section to the budget or whatever. Again, those of you who are out, much more knowledgeable. But those were the two limit. And the third, of course, would be that because it's in legislation, it would survive administrations. And again, some of us know that the most recent administration we came through was not tremendously interested in something like this. So again, having it in legislation, requiring the regular reports, putting this infrastructure in place, gives legs in a way that the previous, voluntary program that was set up by Governor Patrick won't have.
Kate, did you want to add something? And then I see Michael Yogvin.
Yeah. So one of the things that happened with the previous children's cabinet is that it wasn't super robust when it came to early childhood, that a lot of the focus was on older children and adolescents. And there was even a point at which I think then Commissioner Killens was talking about the possibility of a sub-cabinet that was focused on early childhood. So that would be one, and again, as we are continually trying to change the investment approach towards promotion, prevention, and earlier intervention, to change the long-term trajectory for kids and families. I think that would be critical. And just a plug that, please don't forget DPH, especially when we're talking about young children. We serve more young children than any other agency between WIC, early intervention, and home visiting.
Thanks, Kate. And I think to Kate's point, we also are in a different time in the world. So yesterday at the revenue hearing, young children and families came up so much more than I think probably, and then, even though I was there at 4:45, to hear people talk about it all day was encouraging. So Michael and then Aisha.
Yeah, I just wanted to emphasize the need for this broad focus on the whole child. It's not just healthcare. It's not just education. It's maternal health, maternal mental health. The reason I'm late is I was just on a call with Healthy Steps about postpartum depression screening. One of the things that we need to think about, the fact that 80% of the time kids don't spend in school, we're now working with Playful Learning Landscapes on dealing with urban neighborhoods, with playgrounds, laundromats, supermarkets, bus stops, a lot of places where, is downtime with kids and parents, but opportunities for language learning, for literacy, for all these other things that are part of kids' lives that we can do. So kudos, and hopefully we can get this done. And certainly the focus on early childhood and prevention and health would be a major shift for our transforming our healthcare system, which is so focused on devices and procedures and not on listening to parents and kids.
Thanks, Michael. Then we'll go to Aisha, and then we're gonna have to zoom off to get to our next Zoom room of the early childhood agenda, where we hope we'll see folks. Aisha.
I just wanted to applaud the efforts of Greg and Charlie and Amy too, in your consistent leadership in this space, this ever big, large space. I think we really feel so strongly at Children's Hospital and Community Health about this whole child approach and about the importance of thinking about families broadly, right? And in the healthcare space, as we work with our other systems that are not as child focused, really getting people to think about families, I think is so key and so important in this context. So I just want to make sure that's one way that we elevate it. Another way that we can find common ground is when we talk about economic mobility, right? Early childhood is a necessity. Everyone on this call knows that, in order for families to really become more mobile and stay stable. And so those are just two things to continue to leverage when you're talking to folks about this. And the other thing, at the risk of sounding a little Boston centric, we do have government structures right now that really are standing up behind early childhood, right? In Boston, we have an Office of Early Childhood, and they're thinking very deeply about how to really connect pieces of government and have a funded infrastructure for supports for young children. And early childhood is a great place to start, right? So having that is a good thing to reflect on when folks say, well, how is this going to work? The last cabinet didn't work. Well, now we have, something happening in Boston that's unprecedented. It's working very well as a partnership space for non-government organizations to engage and collaborate, as well as for government to build infrastructure. So just want to put a plug in for it. I think it's great work, and I look forward to further connections in this space.
Thanks for that, Aisha, and to Greg and Charlie and Michael and Kate and all the work. This is really one of the most significant reasons of having this early childhood agenda that cuts across these sectors is so critical. Hope you will all join us at 10 a.m. over on the agenda, where we'll have much more updates, including updates from lead advocates who are working on different parts of the agenda. Thanks so much for joining us.